What about inflammation and wound healing? As a surgeon, I depend upon inflammation to heal wounds. Now, you will hear some people saying inflammation is the root cause of all disease. It's not. Inflammation causes everything. We have to tamp down inflammation. You can't and you shouldn't. And that includes in dealing with surgical wounds. I've done thousands and thousands of surgery, and have I ever once told a patient to put ice on a surgical wound? Never. Why is that? Simply because we depend upon inflammation for wound healing. But inflammation has a good part and a bad part. So the good part is inflammation causes a little bit of redness, pain, swelling. You probably experienced it if you're an erstwhile carpenter like I am and managed to hit your thumb instead of the nail. You'll see it's getting red, it's getting swollen. That's your body healing. It will dilate up the blood vessels in the area, allow the white blood cells to escape and start cleaning up the dead tissue, cleaning up any bacteria that are in there, and then it will start reabsorbing it and the swelling will go down after a time. Well, what if you put some ice on that and decrease the swelling? You will improve nothing. You will feel better temporarily, but you will not do anything except delay healing and delay inflammation, because the inflammatory response depends upon the enzymes of your body and the cells of your body, and they work best at around 95 degrees to about 104 degrees. Too much higher than that and too much lower than that, they don't work well. Healing will be delayed. This is why you don't see surgeons putting ice on wounds. Now, someone will say, well, what about orthopedic surgeons? They do it all the time. Simply put, they're probably wrong. And most of us who are in the field of wound care and the field of dealing with wounds all the time don't understand why they do it other than it makes people feel better. Well, you can have that argument, the discussion if you want. I'm not interested in it because they do what they do. What I will tell you is that when it comes to inflammation, too much inflammation we can see in certain things. Let me give you an example. People who have rheumatoid arthritis have an overabundant immune system that starts attacking itself. And when they have that, we have to give them very, very powerful anti-inflammatories. The good news is we can tamp down that inflammation like tamping down a fire. The bad news is that we tamp down other inflammation in the body that's good too. So there's a good side and a bad side to anti-inflammatories. What about anti-inflammatories for simple pain, like a surgical post-op pain? It will decrease inflammation, not enough that it will cause a significant delay of wound healing. That's never been shown, but it does give you more comfort. Because remember, when you have post-operative recovery, we do want you to move, we want you to be comfortable, we want the inflammatory system to go on, but we don't want it to go over. You've also probably experienced an overactive inflammatory system. You've gotten the flu, or you've gotten COVID or pneumonia, and you have aches and pains and fevers. That's your body's inflammatory system working to get rid of bacteria, viruses, etc. A little too much of that, you feel miserable. You take an aspirin or you take a Motrin, you will feel better in about 20 minutes. Will that delay healing from pneumonia or from influenza or COVID? No, it doesn't, but it does make you feel more comfortable. In COVID also, we learned that if we use high-dose steroids, we can decrease inflammation in the lungs and help people recover from COVID faster. So there's a lot of things about the immune system and the inflammatory system that we need to do and understand. It is an exceedingly complex topic at the molecular level, and it is terribly important. People who say all inflammation comes from the gut, they're just ignorant and they're incorrect. People who say things like eczema is an inflammatory system, it begins in the gut, is ignorant and it's uninformed, and they're just people usually trying to take advantage of you. Please, the inflammatory system is important. Too much inflammation is bad. We deal with too much inflammation because we have powerful drugs, but we know very well that there are risks in doing that powerful drug. But the reward is allowing people to have more mobility, longer, preserve their joints, etc. What are the best things you can do at home for inflammation? If you have osteoarthritis, bone on bone, there is no doubt that you should get up and walk. Exercise is one of the most powerful things that you can do to help you maintain mobility. People who walk more, even with bone on bone disease, delay the need to have knee and joint replacements by years because of mobility. Will taking an aspirin or Motrin have a problem with that? No, it won't. It will be there and keep you comfortable. So understand, the immune system and the inflammatory system are exceedingly complex. They're far more complex than people might want to fool you about. But We don't put ice on wounds because that will delay healing. You don't put too much heat on wounds because that will do it. You can put some gentle things, but understand your body will take care of itself. And if it's too much, don't go on TikTok and ask the people here what you should do for it. Ask your doctor. And sometimes they might contradict science and sometimes they might not. This is just some basic information for you to learn and get in your armamentarium because we don't want people taking advantage of you. I'm Dr. Simpson. Like, follow, share.